You see, the medical laboratory is the tool for defining outbreak, monitoring the progression of outbreak, and declaring an end to outbreak. The case in Nigeria is that the medical laboratory, that essential tool and profession, has been put in the background, have been put and been shut out, and we are managing COVID-19 pandemic in Nigeria. And that's why I had to thank him for what he had said. The best time to stock up your armory is at the time of peace, not at the time of war. Now, we are caught between the devil and the deep blue sea with regard to testing. The CBN have released enormous sums of money, which they said will go to loan to health laboratories, support to pharmaceutical and all what, support to medical laboratory scientists and other Nigerian scientists to collaborate with their counterparts abroad towards the production of testing devices, testing kits, and vaccines ultimately. Now, the countries you are to collaborate with, the big countries in Europe, the big countries like the US, the United Kingdom, they have their hands full with the same challenge. Is this the auspicious time to do that kind of collaboration? Where we did not prepare. The truth is that he said we do not have adequate testing facilities.
We have 5 in the country.
We have 5.
Like we were told.
We have 5 as we were told. And thanks to the National Center for Disease Control, under the able leadership of Dr. Chikwe Ihekazu, those laboratories, those public health laboratories, were not there before. The coming of Chikwe Ihekazu, his assiduous effort, had bequeathed that to the country.
All of them or some of them were
all
not.
of them, all the 5. There was no laboratory in Gadwa before he came. There was no...
I know the Irua.
The Irua was a specialist hospital. It was not upgraded or scaled up to a public health laboratory for this magnitude of disease containment. Now, those 5, you cannot separate NCDC and the leadership of Dr. Ihekazu. But that said, that is to serve 200 million people. That is to serve a country with a landmass of over 8,000 square kilometers. And to say, to put it properly, the 5 of them, their location is skewed. Now, the truth is that...
What are their locations?
You have the ones I mentioned in Gadwa in FCT. You have the one that is still fledgling in Ebonyi State. You have the ones in Lagos. You have the Irua you had rightly mentioned.
In Edo State?
In Edo State. So if you look at it, it is from the FCT and to some parts of the southern states. That is skewed. That is not right. Now, the truth need be told. We have well over 70 teaching hospitals. We have well over 22 federal medical centers.
That's over 100 federal medical institutions.
Exactly. In health system, the tertiary health care level, where these 2 categories of hospitals belong, is the apex of healthcare system. And if we say to ourselves that laboratories in these 2 places across the country that had a good spread cannot be upscaled to provide this level of testing, it shows how ill-prepared we are as a country. Now, the point need be made. Even when I listened to the officials of the Federal Ministry of Health, the kits we're using for testing presently were donated to us by the German government, an institution in Germany. Now, the truth is this. Before this pandemic hit the world and came to Nigeria, when it was circumscribed in China, that was the time for us, the window period, for us to have done the needful. We did not do the needful. What were supposed to have been the needful? Bring multidisciplinary, multi-professional, and multi-sectorial workforce, largely more of medical laboratory scientists, and you train them. That has not been done. We have a workforce.
We have to upgrade the laboratories.
We have to upgrade laboratory infrastructure. We have to train the human resources. We have to do the requisite procurement, not just because COVID is here. We have had Lassa with us. We have had meningitis with us. We are going to also have them come because we're gradually moving into the hot times. We may also have the cholera outbreak come again. Why must it be these 5 labs owned by NCDC that will have capacity for this?